Police officers answering calls involving people with mental health or drug abuse issues now have an additional resource in Dutchess County, the Stabilization Center. As an alternative to the hospital emergency room or the county jail system, the Stabilization Center provides immediate assistance and services to de-escalate a crisis.
An individual police officer with this training is able to identify a problem and make the decision whether or not the individual deserves and needs the mental health care that we'll provide here 24 hours a day, 7 days a week, or the more extreme of emergency room or a jail setting. Our goal with the training is to provide the tools and the resources for each individual officer to know how to respond to those situations and make the most beneficial, most effective decision and de-escalate a situation.
On Thursday, Dutchess County hosted a reception at the center to announce the opening and recognize its partners.
We're providing nursing staff around the clock to actually work at a stabilization center where patients can be transported by the police, by self-referrals, by community agencies, and come to the stabilization center where they'd be assessed as to what level of care they would need. And if they need a more intensive level of care, they can be transferred to the hospital. So this is a novel approach. Actually, history is being created here in Dutchess County, and it should be a replicable activity in the rest of the state.
Unless you really begin to provide alternatives to institutional care, whether that's the emergency room, unnecessary hospitalization, unnecessary readmission, unnecessary incarceration, and criminalization of mental health, you really can't move the needle. And this is why this is really a bold move for which we commend the county.
As part of the grand opening, the Stabilization Center has been dedicated to Dr. Kenneth Glatt, who served 35 years as the county's Commissioner of Mental Hygiene and was the driving force behind intervention programs that stood at the forefront of the Stabilization Center.
In addition to the Stabilization Center is the Mobile Crisis Intervention Team, 24-hour helpline, and the Partial Hospital Program. And each of those programs were newly equipped and outfitted and moved into space that was larger, more professional, and better than the space they had previously occupied. Very impressive.
Law enforcement officers and first responders throughout the county will continue to receive crisis intervention training and can now rely on the Stabilization Center as a vital resource.
We must accept that addiction is not criminal. Mental illness does not mean that you ought to go to jail, but rather acknowledge the reality that every one of us is confronting our own demons and our own challenges, and that when they break, when they snap, when they get to such a point, there is a resource in place that they can turn. And in this community, they can turn to us. The relationship and the partnership we have created in one place, under one roof, to provide assistance and help. And you, each of you, deserve the credit and the acknowledgement for your commitment to making this a reality, and I thank you for that.